Hello everyone and welcome to today's video. New format today, trying something. Don't know if it's going to be any good, but bear with me, I'm experimenting. So today I came across this article in NPR and it was talking about what could be potential new goals for the WHO since it is their 75th anniversary today. And I thought I'd go through it and talk about it a little bit. So the first thing they've mentioned, and what they did was they went out and asked experts in the field of healthcare what they think should be a goal for the WHO to put on their agenda. And these are the points that they have included in the article. The first thing is teenagers need more attention. I would agree with that. You know, in recent years, things that were not so common have become more common among the teenage population. Things like mental health challenges, depression, obesity, as mentioned in the article right here, and even STIs have become more common. And there is no denying that it seems like it's just getting worse. So we really need to change the focus on how we deal with these kinds of things because there seems to be something lacking in the way we're managing it. There needs to be more of a focus on prevention, finding out what the root cause of the increased mental health issues is. People love to just, blame this and blame that, and I don't even want to try and guess at what it is. We need research, we need data, we need statistics, and then we need to work on solutions. So definitely, I think this should be a priority. Next is an interesting one. Get the world to trust you. Because it does seem like people have lost a lot of trust in the WHO after the COVID-19 pandemic. Not that they did anything particularly bad or wrong in the way they dealt with it. It just seemed like the response was slow and they weren't very good at communicating with the public. So it seemed to the public like they were backpedaling on things they said before and they were flip flopping and changing their mind, when in reality, it was just, the science progressing. It was just data, new data coming in, and them adjusting and adapting their guidelines based on the new data. But to the public, because they weren't very good at communicating, it seemed like they are not so trustworthy after all. And that is what they need to work on, because if people don't trust them, then one of their main functions, which is, fighting misinformation and giving good information, high quality evidence based information to the public, they won't be able to do that. So this is definitely an interesting one. Ethics. I think ethics is going to take the place front and center in the next few years in terms of the world of medicine and other fields, but especially medicine, because the advent of AI and supposedly what's going to be now a rapid era of accelerated growth in the field of AI is going to really push the boundaries of the construction that we already have of medical ethics, because it doesn't seem to be able to cover a lot of the different dilemmas that might potentially pop up. Now, they've also mentioned things like CRISPR over here, and this example, like what happens if a country bombs its own civilians? What's the WHO supposed to do? These are interesting. These are interesting, and I don't have the answers, but it's definitely worth thinking about. Now, this one I think is one of the most important ones that is often neglected. Consider the health of the planet, because what we don't realize is that nothing on Earth is an isolated system. Everything, everything is connected. And just a simple example, for example, zoonoses, right? Those are conditions that are passed from animal hosts onto humans. One of the theories of how zoonoses come about and suddenly jump from an animal host to a human is that habitat destruction pushes animals and humans closer together. So if a virus, for example, is residing in an animal and it mutates to be able to infect a human host, and now you have animals and humans living in close proximity because of habitat destruction, that just becomes a lot more likely. So that's just one example. Of course, there's more obvious examples. You have air pollution, you could have respiratory problems, and such. More things like that. There's no end to this discussion. The next thing, shave down the bureaucracy for faster response time. So there was a lot of talk about, even with the COVID-19, pandemic, that they didn't declare it fast enough or soon enough. And the example they've given here is that of the West African Ebola epidemic in 2014. They say that many experts said they took too long to declare the outbreak. And this kind of thing, if this delay is because of bureaucracy, then that can cost real lives. So this is definitely, I think, a worthwhile goal. More autonomy to respond to disasters. This is an interesting one. Because on the one hand, more autonomy does mean that they'll be able to react faster. And that could save lives. But on the other hand, more autonomy could make them lose trust as well. So it's an interesting one. I think I definitely would want to read more on this topic. Next, it talks about long COVID, especially in Africa. Now, this is really interesting because long COVID is something that we really don't know too much about. And we do have cases, people getting all sorts of long-term effects on the body. And we definitely need more research on this. This next point talks about giving a voice to the voiceless. Now, what they mean by this is that sometimes what happens is that if a first world country doesn't have too many cases of a particular disease, but that disease is very prevalent in third world countries, what can happen is that the rate of research and development of new treatments, new ways of prevention of that particular condition slow down because there aren't that many cases. It doesn't have as much of a burden of disease. But in the third world countries, it's still rampant. So what can happen is that those third world countries can suffer because most of the research on these things happen in the first world countries. So things like cholera, for example, or malaria is another classic example, can really, really wreak havoc on these third world countries and their populations. And just because the incidence of these conditions has decreased in the first world, we should try and make sure that we still have research ongoing for those people who live in the third world countries so that they can get treatment as well. And that's it. Thank you for watching. I don't know if this new format is going to work or be any good, but you have any comments, leave them down below, and subscribe if you want to see more videos. I'm going to try different things, and we're going to see how it goes. See you next time.